Hello, who are you? This time we be uh, presenting the time of facial paralysis. In the subject of English to teacher Mercedes Flores Adam, I will be accompanied by classmate uh, Fabián, Kenia, Katherine, Johanna, Alejandra, Jessica, Noira, and your servant Dulce. Uh, Hoping that this presentation is to your liking, we begin. Uh, what is this? Facial paralysis is a neuromuscular disorder caused by injury to the motor and sensory pathways of the facial nerves, cause an alteration of movement and in the muscles of the face, in the secretion of saliva, tears, and the sense of taste. What does is produce? Facial paralysis produces a severe deformity in both functional and aesthetic due to injury of the sep- seventh cranial nerve. It's incident in 70 cases per inhabitants. Uh, the alteration of the seventh cranial nerve produces mainly a paralysis of the muscle of facial mimicry, generating alteration with aesthetics, functional, sociolabor, and the quality of the life. How is the present? The affected patients might have various disabilities, facial muscle function, and expression facial with impossibility to close, to eyes, raise the eyebrows, smiling, taking, and eating.
Epidemiology. Facial paralysis is a relatively frequent pathology with incidence between 11.5 and 40.2 cases per 100,000 people year. There are no differences in terms of race, geographic distribution, or sex. It can appear at an age, being more frequent after 65 years of age and rare in those under 15.
My name is Kenia Camacho and I'm going to talk about the symptoms of facial paralysis. The symptoms are facial paralysis on one side of the face. Rarely are both sides of the face affected. Loss of blinking control on the affected side. Decreased steering. Dropping of the mouth to the affected side. Altered sense of the taste. Allure speech. Drooling. Pain behind the ear. Sound hypersensitivity on the affected side. Difficulty eating or drinking.
Treatment. Treatment of face paralysis depends on many factors, including the patient age, cause of the paralysis, severity of paralysis, and duration of symptoms. Symmetry of facial features usually can be regained if the patient in the facial muscle. Retrain and therapy. Both are critical success. Doctors at facial plastic and reconstructive surgery clinic treat facial paralysis by transferring muscle and repairing blood vessels and nerves. The treatment is determined after the assess of symptoms and is tolerated to each patient needs. Treatment may include one or more of the following approaches. Number 1 is directed restenosis of nerve. Graph to help restore nerve functions to neurons stay together the severed end of damaged nerves. If the ends of the nerves can be sewn together directly, a piece of nerve is harvested and used as the connector or graph between the two ends. Number 2 is eyelid procedures. Lower lid thickening procedures and upper lid weighting operation are used to treat eye condition. Platinum or gold weights may be implanted under the skin of the upper lid to allow the lid to close, possibly with the gravity. These procedures are usually performed in a clinic or procedure room.
Hello, my name is Johanna, and we tell to you about the treatment of the physiotherapist for facial paralysis. Okay. Physiotherapy treatment, it can be any of the following points. Point 1, local head or as we know it a hot compress. The compress helps the muscles of the face relax and helps blood vessels relax in order to have good circulation and facial. And this compress so lasts 10 minutes maximum. Point 2, electrotherapy. These are patches that transmitted electricity to the muscle and are placed in the specific area where therapy is needed, and this makes the muscles contract. Point 3, muscle reduction in front of the mirror. This treatment is based on the patient looking at himself in a mirror. Will the physiotherapy exercise in him so that moves his facial expression as far as he can. And point 4 is assisted activity exercise. In the treatment, movement or massage are performed where the physiotherapist helps the patient to make movement in the effect are on one the exercise can be lifting the eyebrow, closing the eye, etc.
Facial expression serves as a sophisticated mechanism to convey emotional information during social interaction. A breakdown of the important social communication to affects both a person's self-concept and observes inference. One potential breakdown experiences the patient is the loss of facial nerve function patients with facial paralysis can have impaired facial movement and resting facial asymmetry resulting in the facial deformity. Facial paralysis is a neuromuscular disorder causes the injury to the motor and sensory pathways of the facial nerve, which cause an alteration of movement in the muscle of the face in the secretion of saliva. There's an eighth sense of movement taste.
Hello, my name is Yesica Cárdenas and I will talk to you about two methods in used in facial paralysis. Patients will face paralysis of all levels of severity and etiologies were eligible in paralysis. A heterogeneous group and control patients with facial paralysis was probably enrolled and initial presentations to facial plastic surgery clinic. All patients 18 years or older and English speaking were eligible. Patients were excluded in the way where you 18 years had pure facial paralysis surgery, had head and neck malignant neuroblast, had pure head and neck surgery, and were unable to independent complete questionnaires. Patients were did not have demographics of psychometric that were excluded from the model analysis. Patients were not compensating for participating. Data collections, demographic information, clinical historic, facial paralysis etiologic, lateral of facial paralysis, and facial paralysis severity well college, build training, student personnel. Demographic that includes age, sex, race, material status, height level of students, and socioeconomic status. Facial paralysis etymology was determined by clinical historic. The house breakman rate was determined from baseline photography. Study objectives. The primary objective was to measure the associated behavioral depression, QOL, and facial paralysis. The secondary objective was to determine the likelihood of streaming.
And results in patients with facial paralysis and significantly heavier depression, lower self-report depression, attractiveness, and lower mood and lower quality of life scores.